A study coming out of Brazil has really got the scientific community buzzing, as it showed some incredible findings from a common simple supplement at low doses, and it's also a supplement Dr. Michael Greger recommends for most people. We'll look at the exact dosages towards the end of the video, so stay tuned for that. The research conducted at the Botucatu School of Medicine at São Paulo State University was published recently in the journal Nutrition and Cancer. It involved 80 women over the age of 45 who were about to start treatment at the oncology outpatient clinic of the General and Teaching Hospital. They were put into two groups. 40 of them took a low dose of vitamin D a day, while the other 40 received placebo tablets. After 6 months of cancer treatment and supplementation, 43% of participants using vitamin D saw their disease disappear, compared to 24% of the placebo group. Quote, even with a small sample of participants, it was possible to observe a significant difference in the response to chemotherapy. What was also interesting was most of the participants in the study had low levels of vitamin D, defined as less than 20 nanograms per milliliter, and we should really be aiming to be between 40 and 70. With the supplementation, levels increased throughout chemotherapy treatment, which reinforces a possible contribution to the patient's recovery. Vitamin D is an accessible and inexpensive option compared to other drugs used to improve the response to chemotherapy. But for those that aren't undergoing cancer treatment, why is this so exciting? Well, it's because it's unearthed an effect of low-dose vitamin D that we hadn't seen before. We've known it aids in the absorption of phosphorus and calcium, which is essential for our bone health, but recent studies have shown that it also plays an important role in the immune system by helping to fight infections and diseases, including cancer. What's amazing though is up until now, most studies linking cancer and vitamin D supplementation have used high doses of the substance. But in this study, relatively low doses were used with amazing effectiveness. And these findings could be a game changer and suggest that vitamin D could be an alternative to hard-to-access drugs that also aim to increase the response to chemotherapy. Quote, these are encouraging results that justify a new round of studies with a larger number of participants. This will allow a greater understanding of the role of vitamin D in increasing the response to chemotherapy treatment, and consequently in the greater likelihood of breast cancer remission. The dosage used in the research is the same amount Dr. Michael Greger recommends for most people who aren't getting adequate sunshine. It was just 2,000 international units per day, and the authors noted that this is far below the target dose for correcting vitamin D deficiency, which is usually 50,000 international units per week, which makes the findings even more fascinating. Dr. Michael Greger received some shocking blood test results, saying, quote, my levels were the same as an elderly person in a nursing home. So in this next video, we'll hear him discuss that and what he did to correct it. To view that video, you can click the middle of the screen now.